Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello, thank you for tuning in to the training on the new mobile app innovations for home health clinicians. I am Shannon Bailey, a nurse and product manager for the Axxess Home Health Solution. Axxess offers a mobile application for the home health, home care, and hospice solutions. Today we will look at some of our home health mobile features. Let me share the agenda for today. We will see 4 of the recent features we have released for the mobile apps. Then for those who are not familiar, I will give a brief introduction to Axxess CARE and show you where Axxess CARE is available. I will give you a sneak preview of some of our cool upcoming features that you will see this year. And then I want to guide you to the opportunities for the support that are available to you. For Axxess Home Health, we have the Home Health mobile app and the Axxess CARE mobile app, both offered on Android or iOS devices, a phone, or a tablet. Our mobile apps let you work anytime, anywhere, schedule and track visits, have access to care plans, verify visits at the point of care with a patient signature, or even a voice recording. Our new features that we will see today are the Load Previous Notes, COVID-19 Updates, Wound Manager, and Supervisory Visits. Load Previous has been available on the Home Health mobile app, but is new to the Axxess CARE app. I wanted to show this today because this offers the clinician in the field some very useful information. Please know that this is permission-based, and if you are not seeing the label and arrow, request the permission from your administrator. So you can see that on my app, after starting your visit, you will open to the tabular view, and at the top of the page, you will see the Load Previous prompt and the arrow. When you tap on the arrow, the last 5 most recent visits will show in the list. You can select the visit from another clinician or your own prior visit. You will receive a warning when loading this documentation that it will erase any current changes on this note. So that means that if you are going to use the Load Previous feature, you need to do that first before you begin documenting your assessment. Items that will never be the same, such as vital signs, last bowel movement, and the pain assessment, will not be loaded. Loading the previous visit gives a good report on the last visit so that you can compare your current assessment findings to that of the last visit. This is great information, and reporting is the expected clinician practice. This allows you to recognize the changes in the assessment and take action when necessary. Loading yours or other previous documentation also speeds your current documentation. The clinician must complete the assessment each visit, but it is common for some systems to be unchanged from visit to visit. For example, the neurological assessment does not commonly change. When the patient wears glasses, has a hearing loss, or paralysis, we do not commonly see a change or resolution in these issues. What does change is the patient's behavior related to these issues. Maybe the patient quit wearing their glasses or hearing aids, and teaching is more difficult or requires more tools and resources. The assessment would not change, but the patient's behavior related to these issues may change. When loading previous, you are able to edit for the changes and keep the documentation that has not been changed. This significantly decreases documentation time. Next, we have a group of features in response to the pandemic. Axxess has built multiple features to assist with managing the COVID-19 patient and comply with CDC guidelines. The COVID-19 screenings for clinicians are available from the 3-line menu in the Home Health Mobile and Axxess CARE apps. From the Home Health mobile app, tap on My COVID-19 Screenings. With your consent, you will see the historical view of previous screenings. You are also able to complete a new screening by tapping the blue Add COVID-19 Screening button. You will enter your temperature and answer the 4 questions. The risk level is determined per the answers to the questions and per the agency policy related to high or low risk determination. There is a comment box that offers the template menu for those organizations that have policies pertaining to the screening, but also allows free text. You can use this text box to enter your vaccination history. Then there's the screening acknowledgement that is required to submit the screenings, that just says you recognize the risk of this patient and that you will treat them per guidelines. Then the populated date and time are entered and are editable. And when the save and exit is used, the signature will be available and will complete the screening to be saved to your user profile with your organization and for you to view here in your app. The COVID-19 screenings for patients, household members, and non-staff caregivers are available within the visit note under the Infection Control tab or from an OASIS from the Risk Assessment tab. You will see the prior screenings here for historical reference. Tap on the Infectious Disease Profile button, then tap on the Add COVID-19 Screening button. Then you will select the person screened, the patient, household member, or non-staff caregiver. The patient screening is the same as the clinician screening other than the person screened. In this screening, you can select patient, household member, or non-staff caregiver, and the number of screenings is not limited to allow screening for all persons that may be involved in your visit and in close contact with the patient. For COVID-19 teaching, in the skilled visit note, also under the Infection Control tab, there is a link to the CDC website which gives daily updated news and important information related to COVID-19. In the intervention narrative section, there is a link to Medline plus COVID-19 teaching. And a link to the updated CDC vaccine information. From the Visit Narrative section, the template drop-down menu offers COVID-19 teaching guides, which follow the CDC best practices. When completing the comprehensive assessment, when in the plan of care profile, you have interventions to manage COVID-19 under the problem statement, need for infectious disease management, and under high risk potential for infection. The COVID-19 response has been robust, and this is to ensure that you are equipped with the tools you need. The Wound Manager enables users to document and track wound care across multiple episodes and admission periods in an easy-to-use central location. This feature must be turned on by the organization at the administrator level, so if you do not have it available, ask your administrator. Wound documentation is found in error very often because wound documentation is tedious. The new Wound Manager makes this tedious work simple. To have accurate documentation, there are some rules. The wound management must be documented in chronological order. Late documentation is possible, though wound management cannot be done if that later visit has been started. Wound management includes adding new wound orders, restaging a pressure ulcer, or changing the level of injury to other wound types, deactivating or reactivating a wound. Let's look at the wound manager. You will find the wound manager under the integumentary tab. Color coding gives a quick way to recognize the need for documentation. Dark blue indicates there are no active wounds, teal indicates there are active wounds, and green indicates that the documentation has been completed for this visit. Once you enter the wound manager, you will have access to the history of your patient's wounds. This is the wound list, which gives you the active and inactive wounds for the patient. Clicking on the card of any wounds in the list will open the wound flow sheet. Click on the image to view all images of the wound in chronological order. Click on the wound flow sheet button to view the wound score graph and scroll down to see historical view of the wound details. Let's document a wound. Clicking on the document icon on the bottom of the page will take you to the active wounds. From here, you can load the previous wound documentation for comparison. At the top, you will see a wound description and number. This number assigned to the wound starts at creation and will never be repeated and will remain attached to this wound for the life of the patient. That means if a patient is discharged after a stage 4 wound has closed and then readmitted later with a wound in the same area, this wound can be appropriately reactivated. The image can be captured and loaded immediately. The wound care orders associated will be visible for reference at each visit. The orders can be changed when a physician's order has been written. If a wound order has been entered prior to the visit and using the wound orders profile, you will see a Change Wound Order button. The treatment performed is prepared at the time the order is entered and remains editable each visit, though no change really should be needed. Then complete the documentation, entering comments where needed. You will notice that the last wound measurement is here for reference and to keep you compliant with your wound measurement frequency. So you will document your measurement, your tissue type, and you'll notice that tissue type granulation is noted not to be appropriate for stage 2 pressure ulcers. So stage 2 and less, only epithelialize. But if it's a granulating wound, you will need 100% total of your values in these 3 sections. So my wound happens to be 100% granulation and no slough or eschar today. Surrounding skin appearance, wound edge. Anytime you document an abnormal, you must describe. Wound drainage. You'll describe the type of drainage, the amount of drainage. You'll describe wound odor if it has wound odor. Undermining, tunneling, wound pain, and that is a 0 to 10 scale. And if there's a change in wound type, and this is where you would restage a wound or change the level of injury to other wound types? And are there signs and symptoms of infection? As always, we give you a text box for other comments as needed. And the response to treatment is pre-populated, of course, and may not need any changes whatsoever. If patient is non-adherent to his treatment plan, you can document that here. Save and continue will save the inner documentation to be completed later. If you are unable to complete the wound documentation at point of care, you can save and finish later. But if you know that you will need to manage the wound, add or change an order, restage a wound, or reactivate, deactivate, please do this during your visit, because if another visit has started, you will not be able to make these changes. The safe thing to do is, above all, manage your wound and then return later if necessary to document the wound assessment. This ensures accurate wound documentation by you and by others. If you are finished with your documentation, validate checks the documentation for any missing elements and will highlight any skipped sections. If there are no validation alerts, then your wound documentation will be completed and be ready for the next visit. Wound documentation can be tedious and time-consuming. Using the wound manager makes it easier at point of care with automation and the information that you need. The next addition to the mobile apps is the supervisory visit from the visit note. Aid supervision must occur every 14 days. There is no wiggle room. If the supervision occurs on day 15, you are out of compliance. But now you are able to easily supervise weekly or more to ensure compliance. When in a skilled nurse visit note, or PTOT-ST, assessment evaluations or reassessment reevaluation notes, go to the supplemental documents, the last tab, and tap on Perform Supervisory Visits. You will be able to select a supervisory visit to perform from a home health aide supervision, a physical therapy assistant, a certified occupational therapy assistant visit, or an LVN/LPN supervisory visit. Tap to choose. You will see these options in the menu. Select the supervisory visit for the discipline that you need. Then tap Schedule an Open Note. You will see the visit note with 2 tabs. First, fill in the visit information, select the clinician you are supervising from the list provided, and answer the items needed. Then open the Evaluation tab and follow to answer the questions. There is an option to use a template menu or free text in a comment box. Save note will place the suit visit in the patient's chart to be completed at a later time. Complete note will give you the ability to enter a time and sign. Then the suit visit is saved in submitted status in the patient's chart, awaiting QA, or bypassing QA will be in completed status. I'm excited to talk to you about Axxess CARE for those of you that are not already using the app. And for those who are, I share your joy as I use the app myself. Axxess CARE is an easy way for clinicians to earn more. Connect with more opportunities, enjoy a flexible schedule, choose visits nearby, get paid more and faster, and document with ease at the point of care. Axxess CARE is now available to all Axxess Home Health users nationwide. Clinicians with Axxess login credentials can download the Axxess CARE app through the Apple App Store or the Google Play Store. After completing the sign-up process, the clinicians can begin applying for nearby visits at their preferred rates. Before we get into the app, let me show you how it works. Organizations post visits when there is a staffing shortage or scheduling conflict which means they offer a visit to area clinicians who do not work for their agency. Then clinicians who are qualified to deliver the care and then can apply to the visits that meet their preferences and skill level. The organization will review and compare applicants and then assign a visit to a qualified clinician. Clinicians then provide care according to the scheduled date and visit details and complete the documentation through the Axxess CARE app at point of care. Then payment is released for the completed visits, and the clinician will receive the agreed upon payment by direct deposit when the visit is completed. So let's see how Axxess CARE payments work. When a visit is assigned to a clinician, the payment for that visit is pulled to an escrow account. And when the clinician has completed the documentation for the visit, it will go through the QA process. And when the note has been approved and is in a completed status, the funds for the visit are directly deposited to the clinician's account. The clinician works independently for the organization and is paid by the organization directly. Axxess is providing the platform to connect organizations and clinicians. We are not a staffing agency. The clinician comes independently to the organization, and the clinician and organization form a relationship. Let me show you the Axxess CARE app. To use the Axxess CARE app, you will need to work for an organization that uses the Axxess software. Use your Axxess login email and password. Then you will set up and use your PIN to open the home page. There is a lot of information here, so I'm going to highlight some key pieces. First, let's look at the clinician profile. To be able to get started applying for visits, you will need to complete your clinician profile. This is your traveling HR packet. You will complete this one time, and it will be available to all the organizations for which you apply to a visit. Only those organizations considering you for a visit will see your profile. Go to the 3-line menu and tap on Profile. You will notice an opportunity for a photo here. You must take a close-up photo of your smiling face. This is the first impression you will have on the organization, as it will be in the application view when you are considered for a visit. This image is also used for the clinician badge that is available for the patient upon your arrival. Then you can see your reviews. You are given a star rating and possibly a written review each time your visit note is QA'd. These star ratings are averaged to show on your application. Click on Edit here to see the tabular view of your profile. Under basic information, that you will notice that your name is grayed and unable to be edited once entered and saved. This is a security measure to protect your identity and help prevent impersonation. If your name changes, you will contact Axxess CARE to assist in changing your name on the app. Your address and phone number can be edited by you at any time. You will also have the opportunity to highlight your experience. Please take advantage of that. Being multilingual is extremely valuable in our diverse communities, and organizations seek multilingual clinicians. Entering the second or third languages here elevates your application. Under the Credentials tab, you will enter your professional license. Your license is verified at onboarding and then monthly thereafter. Your license verification is provided by nurses who is able to check every nursing board in the country. An active license is required to apply for visits on Axxess CARE. Your CPR card is also required and validated for the expiration date. We will highlight a soon-to-expire CPR card so that you have enough time to renew your card prior to expiration. Then you can also add any other certifications you may hold. OASIS, wound care, coding. These certifications are valuable. Please share those here. The organizations who post visits may have other needs according to their accrediting agency, such as Joint Commission or CHAP. For example, auto insurance. Upload a picture of your auto insurance card under the Other opportunity. And label with the type of document you're loading. You can see that I have entered my driver's license and auto insurance because one of the organizations I make visits for has requested these. The skills assessment is your attestation to the level of your skills. State accredited agencies are able to accept this skills assessment to meet the state regulation. This skills assessment also serves as a filter for the visits presented to you. You will see only the visits with the task with which you are at an independent level. Then let's look at the Preferences tab. Under the Preferences tab, you are able to specify your optimal pay range. Also, distance and days available to cherry pick the visits you really want to do. Because we have limited time, I will skip to the banking information under the tab for payment account. You will enter a bank account for direct deposit. This should be a checking account, and we recommend that you open an account dedicated to your Axxess CARE payments. This allows you to reconcile your payments with ease. Please know that we do not store or display your account numbers. Even you will not be able to see the entered account number once saved. These are provided to Checker, the third-party vendor who manages the payment from assigning by the organization until released to your account. They do have security measures in place and are a trusted partner to Axxess CARE. You can change your account at any time. Your bank is validated and you will be alerted if the account is not valid. The next item is the tax documents. You are an independent contractor when you apply for visits on Axxess CARE. Axxess CARE is not a staffing agency. That means the relationship is between you and the organization. You must provide that organization with a W-9 form if you have earned $600 or more in the year so that they can comply with IRS rules, and also provide you with your 1099 that you will need for your tax needs. Because you may earn $600 or more from multiple organizations, you can upload your form here to be available to each organization who requires it. Axxess CARE provides a link to the IRS form so that you can print, fill, sign, and then upload here in this space. When an organization prepares a 1099 for you, it will be found here as well. Another helpful feature from the 3-line menu on the app is the organizations list. This is a list of organizations that are within 50 miles of your location. If there is ever a time when you are not seeing enough visits posted, this list gives you the ability to reach out to organizations in the area and offer your skills. You will be able to favorite some of your organizations and see them exclusively in the Favorites tab. When you are ready to apply for visits, you will go to the Visits page to see all of the posted visits that meet your preferences. You can change your filters to restrict or broaden the number of visits you have to view. You can increase or decrease your pay range. You can increase or decrease your distance from your location. You can also change your skills competencies to see just 1 or 2 tasks that you are interested in performing. You can select a date range or even the location, city or state that you would like to apply to. When you are interested in a visit, you tap on that visit to see the location on a map, message the organization, or apply. Once you apply, the organization will see your application alongside the other clinicians who have applied. The visit will show up on your Applied Visits page, accessed via the 3-line menu, and when filled by another clinician, you will see a visit filled indicator. There's no waiting or guessing. When you have been selected, you will see the purple banner across the home page that gives you the time countdown before this visit expires for your acceptance. Tap and accept. The visit will land in your schedule, and once the visit is completed by you and submitted, your documentation will go through QA, and when approved, funds are released to you. There is so much more to see on the Axxess CARE app and still more to come, so stay tuned. So let me share the upcoming features. And within the next few months, clinicians will have these new features available to ensure easy point-of-care documentation. For the OASIS, we will be able to complete edit patient information, advanced care plan, the OASIS audit to check that all your OASIS questions have been completed and none are skipped, the OASIS scrubber that shows inconsistencies in your assessment and OASIS questions. And you will be able to sign and complete from your mobile device. And then also coming are the other needed tasks from your mobile, like adding a pharmacy, completing an infection log or an incident log, and even completing an aid care plan from your mobile device. At Axxess, we are striving to be mobile first, and we are excited that you will be able to complete documentation start to finish. We are also very excited to introduce the Axxess certification program that offers industry knowledge related to home health, home care, and hospice. The healthcare industry is changing and healthcare is coming to the home. The pandemic is speeding up this trend. Care at home is significantly different than in the hospital, and whether you are a seasoned home health clinician or just entering the care at home space, this certification will boost your knowledge and increase your value to organizations. Look for the Axxess certification opportunity and be among the first to become certified. Also, we want you to know that Axxess is here to support you. The Help Center provides instruction on all features and functionality of Axxess software. This includes all solutions and product. And there's a search feature to find your topic easily, and the details are clear and thorough. The new Axxess user community is a growing group of Axxess users and is a resource for people in your chair. This group supports the home health community and is a great place to find answers to your questions about the industry, clinical practice, and processes from people in the trenches with you. You can access the user community from Axxess Central, from your dashboard, under the Help tab, and from the Help Center. We want to hear your concerns, and when in the apps from your 3-line menu, tap on Help. Here you will be able to email Axxess or Axxess CARE from the Need Help prompt. Using this avenue for support loads details that assist us in troubleshooting when you have an issue. We will see the type of device you are using and the version of the app you are currently using. You can add your feedback, ideas, concerns here, and we will receive this needed information in our secure email system. If you are interested in Axxess CARE, please use this number to contact the Axxess CARE concierge team. This is an exceptional team that is ready to assist you with Axxess CARE in any way you need.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on software advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.